Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another commonly asked question, clinical scenario questions, or tell me an interesting case. So for these questions, actually, we can talk about any interesting case to the interviewer, and you definitely need to let the interviewer know your role in this case. And what did you do to take care of the patient? And it doesn't need to be a formal case presentation, which means you can just use the lay language to present the case, and you don't need to use a lot of medical terms. And also, it's better to prepare for two cases uh, for answer this question, because if your interviewer is an expert in that subspecialty of case you are presenting, probably he will ask you a lot of questions, um, especially for that for his subspecialty. So, for example, if your interviewer is a cardiologist and you are talking about a patient with heart failure, so probably the interviewer will ask you a lot of questions on heart failure, and if you if you happen don't have too much clinical experience, especially in the cardiology, then probably you won't be able to answer those questions, which will make your interview very bad. So that's why I would suggest you to prepare for two cases. Um, so if your interviewer is a cardiologist, you can definitely talk about a case with related to other subspecialties. However, if you have a lot of clinical experience and you are very confident to answer those questions related to that subspecialty, so I would strongly recommend you to talk about the case relate related to the specialty of the interviewer. So if the interviewer asks you those questions, you can answer it and show your ability how to treat the patient and how to address those problems. So actually, this is a good opportunity to impress your interviewer. So for example, when I was interviewed, when I was given the interview and my interviewer wanted me to ask him a question, so I just asked him how can he diagnose a patient with pulmonary embolism with kidney diseases, because the patient has kidney diseases, so he cannot tolerate the contrast to do the CT scan or do the angiography for the diagnosis. Uh, so actually, we talked a lot how to do it, and finally we reach agreement how to make a diagnosis for the patient and how to take care of this patient. Actually, the whole process of the interview went very smoothly. So that's why I would suggest you, if you are pretty confident with your clinical experience, you can definitely talk about the case that related to the interviewer's subspecialty. Now I'm going to give you an example how to answer this question. Okay, Dr. Cui, can you tell me an interesting case? Yes, of course. So I remember when I was doing clinical rotation uh, as a resident doctor, and we have a patient who is a 40 years old lady, and she is admitted with severe anemia. So we checked her lab, and all of his hemoglobins as her hemoglobin is low, her hemoglobin is low, and but the interesting thing is the patient iron study is perfectly normal. Well, her LDH level is high, and so I think probably the patient has hemolysis, and uh, also the patient has hypertension, and we checked her other labs, and we found that the patient also has uh, low low albumin level and triglyceride, and this drive me to think that the patient probably has nephrotic syndrome, and but I checked her UA test, which is normal. So I just ordered a 24 hours urine protein test, and also consulted nephrology. And then when the lab came, and as I expected, the 24-hour protein level is urine protein level is positive. So the nephrologist just came to treat her nephrotic syndrome, and send the patient to do the kidney biopsy. And however, the nephrotic syndrome cannot explain the patient hemolysis. So I was thinking probably the patient also has autoimmune diseases. So I further ordered the anti-nuclear antibody test, and when it came back, it's a positive. So I further ordered the double strength uh, DNA test, as well as anti-Smith test, Smith antibody test, which are all positive. So this patient has lupus. So I send the patient to the rheumatology department for further treatment. So I would say that it's a very interesting case. So that's why I would like to choose internal medicine as my future career. Because as I mentioned, the physician just like a detective. We pick up every pieces of evidence from the patient, including physical examination, labs, and all other tests. Then we just put them together, exclude all other possibilities, and finally get the correct diagnosis, which is so interesting. And I really enjoy this whole process. And after seeing the patient get recovered, I feel so I feel so great, and I'm glad to see that. So you can see that in my answer, I just give you a good answer to for this question. I told the interviewer that interesting case that I received I admitted patient in the hematology department who is 40 years old lady with severe anemia, and based on all of her labs works, and I suspect that the patient has a nephrotic syndrome, and then I further did test, and find out that the patient also has autoimmune diseases, and finally uh, confirmed that the patient has SLE. So actually, and then I just tell the interviewer why I choose internal medicine as my future career, because a physician is just like a detective, and I really enjoy this process, and I really like to see my patient get recovered with my help. So I hope you will also create your own answer based uh, on my answers. So good luck.